Welcome to Review Central. This is Nursing Licensure Exam Reviewer number 4. This reviewer is intended for those who are eyeing, or are set to take the Nursing Licensure Exam, given by the Board of Nursing and administered by the Professional Regulation Commission of the Philippines. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous nursing licensure exams. Before we proceed, don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Now let's begin. Please refer to this situation for questions 1 to 5. Situation number 1. Mrs. Rivero, a new staff nurse in a regional mental hospital, is attending an in-service education activity. Question number 1. Which one of the following nursing interventions would the nurse implement initially for a client in panic level of anxiety? A. Encourages the client to describe his feelings. B. Leaves the client alone in the room so he can have privacy. C. Stays with the client to give him a sense of security and safety. D. Asks the client to describe the events before the anxiety occurred to determine the source of anxiety. The correct answer is C. Stays with the client to give him a sense of security and safety. Anxiety disorders involve disorders that contain characteristics of excessive fear and anxiety and linked behavioral disturbances. Panic disorder is a type of anxiety disorder characterized by recurrent panic attacks, the onset of which are unpredictable, and manifested by intense apprehension, fear or terror, often associated with feelings of impending doom, and accompanied by intense physical discomfort. The appropriate nursing interventions for a client who is on the onset of a panic level of anxiety are: 1. Stay calm and be non-threatening. Maintain a calm, non-threatening manner while working with client. Anxiety is contagious and may be transferred from staff to client or vice versa. 2. Assure client of safety. Reassure client of his or her safety and security. This can be conveyed by physical presence of the nurse. Do not leave client alone at this time, therefore choice D is inappropriate. 3. Be clear and concise with words. Use simple words and brief messages. Speak calmly and clearly to explain hospital experiences to client. A client in panic level of anxiety is unable to comprehend anything but the most elementary communication, so choices A and B are not appropriate as well. Question number 2. A common side effect of benzodiazepine anti-anxiety medication is: A. Fatigue. B. Dizziness. C. Headache. D. Hypertension. The correct answer is B. Dizziness. Benzodiazepines are a type of sedative medication. This means they slow down the body and brain's functions. They can be used to help with anxiety and insomnia. The most common side effects of benzodiazepines include drowsiness, lightheadedness, confusion, unsteadiness, especially in older people, who may fall and experience injuries, dizziness, slurred speech, muscle weakness, and memory problems. Question number 3. A therapy characterized by intimate relationship between the nurse and the client over a period of time is: A. Cognitive therapy. B. Gestalt therapy. C. Psychoanalytic psychotherapy. D. Behavior therapy. The correct answer is C. Psychoanalytic psychotherapy. Psychoanalytic psychotherapy is a talking therapy based on saying whatever is going through your mind. This helps you become aware of hidden meanings or patterns in what you do or say that may contribute to your problems. Psychoanalysis requires a patient who wants to learn about unconscious thoughts in their past. On the other hand, cognitive therapy challenges thoughts, which leads to better behavior and mood. Behavioral therapy is a type of therapy that uses behavioral approaches to change or alter behaviors for improved outcomes. Cognitive and behavior therapies are often combined together in psychotherapy treatments known as cognitive behavioral therapy or CBT. CBT helps clients understand how their emotions, thoughts, and behaviors are related. CBT focuses more on current problematic thoughts and behaviors rather than on unconscious thoughts in the past. Gestalt therapy is a form of psychotherapy that is centered on increasing a person's awareness, freedom, and self-direction. Like CBT, it's a form of therapy that focuses on the present moment rather than past experiences. Gestalt therapy is based on the idea that people are influenced by their present environment. A therapy characterized by intimate relationship between the nurse and the client over a period of time is clearly an example of psychoanalytic psychotherapy. Question number 4. Displacement is a defense mechanism exemplified by one of the following situations. A. A married woman is attracted to one of her husband's male friends and treats him rudely. B. A nursing student is unable to report for duty because of severe headache. C. A man does not recall hitting his son when he was a young child. D. The patient shouts at the nurse after her family fails to visit her. The correct answer is D. The patient shouting at the nurse after her family fails to visit her is an exemplification of displacement as a defense mechanism. Anna Freud, Sigmund Freud's daughter, defined defense mechanisms as unconscious resources used by the ego to decrease internal stress ultimately. Displacement is a high-level defense mechanism characterized by the transferring of one's emotional burden or emotional reaction from one entity to another. This defense mechanism may be present in someone who has a stressful day at work and then lashes out against their family at home. Among the given answer choices, the patient shouting at the nurse after her family fails to visit her is a classic example of displacement as a defense mechanism. Question number 5. Separation anxiety is usually first experienced during which stage of psychosexual development? A. Anal. B. Oral. C. Genital. D. Phallic. The correct answer is A. Separation anxiety is usually first experienced during the anal stage of psychosexual development. The 5 stages of Freud's psychosexual stages of development are the oral, anal, phallic, latent, and genital stages. The anal stage begins around 18 months of age and lasts until the child is 3 years old. During the anal stage, Freud believed that the libido source shifted from the mouth, in stage 1, to the anus. Separation anxiety is triggered first by the trauma of birth and later by separation from beloved persons, places, and possession. Please refer to this situation for questions 6 to 10. Situation number 2. An 18-year-old college student, Rebecca, has lost 35 pounds in 5 weeks. Worried about her health, her parents brought her to the hospital for medical evaluation. The working diagnosis: anorexia nervosa. Question number 6. Upon admission, Rebecca says to the nurse, "Why am I here? I am not sick. I don't have any health problem." This statement exemplifies a common defense mechanism used by anorectic clients known as A. Suppression. B. Conversion. C. Regression. D. Denial. The correct answer is D. Denial. Many people worry about gaining too much weight. But in some people the worry becomes obsessive, resulting in a condition called anorexia nervosa. Anorexia nervosa is an eating disorder that can result in severe weight loss. A person with anorexia is preoccupied with calorie intake and weight. People with anorexia nervosa eat an extremely low-calorie diet and have an excessive fear of gaining weight. They often feel better about themselves when they lose weight. They may also exercise excessively. Anorexia is most commonly diagnosed in adolescent women, but it's been diagnosed in older and younger women and men. Regression, denial, projection, repression, introjection, and total defenses are among the common defense mechanisms used by anorectic patients. Rebecca's statement to the nurse is a clear example of denial as a defense mechanism. Question number 7. A relevant nursing diagnosis which Nurse Clarissa can identify initially is A. Potential for infection. B. Altered nutrition less than body requirements. C. Impaired tissue integrity. D. Altered nutrition more than body requirements. The correct answer is B. Altered nutrition less than body requirements. Patients with anorexia nervosa suffer from severe weight loss and their metabolic and nutritional demands are not sufficiently supplied. Therefore, the correct and relevant nursing diagnosis is altered nutrition less than body requirements. Infections may set in and tissue integrity may be impaired as an anorectic's body is severely weakened from lack of nutrition, but it is not the most relevant nursing diagnosis for the given situation. Altered nutrition more than body requirement is for a condition directly opposite of anorexia nervosa. It is for people diagnosed with excessive eating disorders and obesity. Question number 8. A behavior modification program is to be carried out for Rebecca. An appropriate nursing intervention would be one of the following. A. Help her to accept that she has a problematic eating pattern. B. Involve her in any dietary planning to solve her eating disorder. C. Allow her to express her feelings and concerns. D. Give positive rewards for gradual weight gain. The correct answer is D. Give positive rewards for gradual weight gain. Anorexia nervosa has been treated with a variety of therapies. One seemingly successful modality, behavioral modification, has in most cases been used concurrently with various drugs. Being anorectic, Rebecca is obsessive about losing weight and is preoccupied with reducing her calorie intake and weight. Therefore, choices A, B, and C will all be ineffective as Rebecca's condition makes her irrational. Therefore, an appropriate nursing intervention involving behavior modification is to give Rebecca positive rewards for gradual gains. Question number 9. Suicide risk is high in persons with an eating disorder because of depression. The nurse identifies one of the following as an appropriate nursing diagnosis. A. Potential for self-directed violence. B. Impaired judgment. C. Impaired social interaction. D. Ineffective individual coping. The correct answer is A. Potential for self-directed violence is the appropriate nursing diagnosis. Patients with eating disorders engage in different self-inflicted at-risk behaviors, including suicide, attempted suicide and non-suicidal self-injury. Patients with eating disorders are at a high risk for endangering their life and overall health. Suicide is likely the most dangerous behaviors, being particularly frequent in anorexic nervosa patients. Actually, anorexic nervosa is considered the mental health disorder with the highest suicide rates. Question number 10. In caring for client with anorexia nervosa, the appropriate attitudes of the nurse is one of the following. A. Consistency and friendliness. B. Accepting and non-judgmental. C. Firm and directive. D. Non-confrontational and accepting. The correct answer is C. Firm and directive. Since anorectic clients are irrational and are obsessive about their weight loss, non-confrontational and friendly demeanor won't make them change their behavior. The nurse must be firm and directive when dealing with anorectic clients. This includes supervising the patient during meal times and for a specified period after meals, to ensure compliance with the dietary treatment program. For a hospitalized patient with anorexia, food is considered a medication, and it is the nurse's primary responsibility that all medication are properly administered in a timely manner. You have just completed Nursing Licensure Exam Reviewer number 4. If you wish to watch more Nursing Licensure Exam Reviewers, check out our Nursing Reviewers playlist. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful, and feel free to share it to anyone who may also benefit from it. We wish you all the best on your forthcoming nursing licensure exam, and we look forward to your fulfilling career and professional life as a registered nurse in the Philippines. Good luck and God bless.